The theme that we had from sessions 3 and 4 on March 1st were really for clinical research approaches. We had several presenters providing both a community health perspective, an industry perspective, regulatory, biotech perspectives as well, to discuss kind of the cross-cutting challenges in clinical trials for prevalent chronic diseases and ways to how do we meaningfully engage communities and patients in clinical trials, as well as how do we consider these new technologies that could help researchers overcome these challenges. And so one of the first themes that came about was looking at a patient-centered approach, or realizing that we need a patient-centered approach in designing our clinical trials. And there was some discussion from Karen Winkfield in her presentation on how do we, at what stage do we involve patients or community members, and her thought was that we need to include them at every stage of the process. By doing this, you not only build trust, but you're able to incorporate feedback all along the process. And one of the questions relevant to that came up was then, how do you involve patients during those very early stages of drug development when some of the ideas might be very basic science? And patients can advise on this concept. They can review proposals, particularly in those early studies where you're doing patient recruitment, and you want feedback on the proposals and the protocol for those studies, but also in disseminating the results and communicating that information to larger communities about the types of research that's coming down the pike, or other potential downstream clinical trials that might be coming down. There was a lot of discussion on, now that we have all of these different changes in how we operate or conduct clinical trials that were forced upon us because of COVID, there are several lessons that we can learn. And there are a lot of things that we have done and we've adapted because of COVID and the restrictions that it's placed on us that could potentially improve how we do things moving forward. For example, the decentralized trial designs could help us as we move forward to reach an even broader audience. We are much more comfortable with e-consenting, much more comfortable with allowing participants to enter data or collect data in their own homes, or doing sample collection kits, or entering data online and things like that, that could really help us reach a broader audience moving forward. There's also lessons that we could learn in leveraging the clinical data that we already have and using that to contribute to some real world evidence in our study designs, as well as maintaining the collaborations that we have now as we move forward between payers, our regulators, as well as our sponsors. Next slide. So a couple of the other themes that came out of these couple of sessions were it's important to intervene early in the chronic disease process. We have several innovative therapies that are focused on treating disease earlier in the disease progression process. And while we're thinking of these therapies to treat disease, we should consider the patient journey and think about developing therapeutics or therapies to focus on quality of life and not just curative intent. And this is a focus on, one of our presenters talked about focusing on value-based care and managing risk long-term, and really focusing on the quality of life of individuals as well, and thinking about the patient input and what's most important to them in their disease journey. When talking about new technologies, as more technologies are produced, we often have a plethora of data that comes along with them. So, and you have multiple endpoints. And so as we have new ways of tracking physical activity or tracking other types of cardiac activity with smartwatches or other devices, there is a lot of data that could be downloaded from those. And so it's important for us to think about at the front of the study design, clear plans for how are we going to collect the data, which data is going to be most important for our study designs, and how are we going to analyze it. And kind of a final theme of our couple of sessions was really thinking about clinical trials are becoming increasingly complex, but there is room for an innovation in the way that they are conducted and analyzed that is acceptable, not just to regulators, but also to community members and the patients as well. Thank you.